All right, Nico, can you say, welcome to another episode of Healthy Births, Happy Babies?
It's a happy episode. Happy babies.
Hello and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren, your host, and I am happy to be back bringing this episode to you on your baby's milestones in the first year. Milestones are something that is talked a lot about in the first year with your pediatrician, amongst other parents. You might be reading about them. Like, you as a parent know they're important, but you might not know exactly why they're important. You might be stressing about them needlessly, and this information is going to help you, or you might not be attending to any of them, and we're going to give you information about why they're important, why to stick with them, why to be attentive to them, and what you can do about it if your baby's not hitting milestones in the way that they ought to be. Because as Dr. Michael Hall, our guest, is going to walk you through it, they all build on themselves, of going from holding their head up to sitting up to crawling to walking. All of these things are so important, and the midpoints along the way of that for their growth and development for the rest of their lives, really. And so Dr. Michael Hall, I'm bringing on to discuss these things because he's an expert in clinical neurology. He's an expert in pediatric clinical neurology. So he's going to walk us through those important milestones, which ones are the ones to make sure your babies are hitting, why they're important, what you can do about it, and also when not to stress about it. Because especially as a first-time parent, we might be too hyper-focused on those milestones. And if it isn't met like at the third month, but there's wiggle room around it, it can cause unnecessary stress. So that's what I brought Dr. Hall on here to dispel those myths and really to orient you to why they're important and how you can work with your baby on them at home. So I will bring him on in a second. First, I'm going to pause for this message. I'll introduce Dr. Hall to you, and then we'll jump right into the content. My online course, Connecting with Baby During Pregnancy, has been out for a while now, and I've been getting phenomenal feedback from you women who have been learning these prenatal bonding techniques, putting them to use, and having amazing results. The same kind of results that the women in the Rafi study were getting, where by doing these techniques throughout pregnancy, they were having less anxiety and pain during labor. They're needing less obstetrical interventions, including less C-sections. And then afterwards, the babies are sleeping better, which means you're sleeping better. And postpartum depression was less than 1% in the moms who did these techniques. So go over to my website at drjwarren.com/CWB and learn all about it. I think this course is amazing. I put a lot of effort into it, and I think it'll really help you have a healthier, happier, and more relaxed pregnancy and a gentler yet powerful birth. Okay, as I said, our guest today is Dr. Michael Hall. He's been a practicing chiropractor, and he's been teaching clinical neurology since he graduated from Parker College of Chiropractic back in 1990. While primarily practicing in North Texas, Dr. Hall also has been the executive director of the NeuroLife Institute, where he and his team provided advanced care for advanced neurological cases, professional athletes, and children with special needs. In addition to teaching and practicing, Dr. Hall has published and presented multiple scientific papers and clinical case studies at conferences globally. And he's also the founder and developer of Brain DC, a recognized resource for patients and doctors seeking expertise in functional neurology. He is a teacher with the ICPA. It's an organization, the International Chiropractic Pediatric Association, where he teaches clinical neurology in a pediatric setting to other chiropractors that are working with a lot of kids like myself, and it's through my association with the instructors there that I was picking his brain about some things to help me in practice and wanted to bring him on here to talk about these milestones with you. So with no further ado, let me switch over to my conversation with Dr. Hall. All right, Dr. Hall, thank you for joining us on the podcast. Welcome.
Thank you, Dr. J. Happy to be here, sir.
Yeah, I'm excited to have this conversation because milestones are something that every new parent kind of freaks out about. They know that they're supposed to be um, that they're important. Sometimes they can be obsessive, sometimes they're negligent. So bringing an expert on like yourself that teaches lots of doctors around the world and obviously patients in your own office about these things, like they'll get the realities, the truths, the myths about it. So put some parents at ease today. So thank you for joining me there. Before we start though, like tell us how you really came to have this area of neurology and pediatric neurology being like one of your expertise and your passions.
Well, Jay, thank you, first of all, for having me here. It's an honor to be able to be on your podcast as well as have the opportunity to share this information with patients. You touched on a word that's so key is understanding milestones. And we need to comfort a lot of the parents out there about today's child. And things are different today than they were last year, last decade, and 2 decades before. So this is a quantum time for us as chiropractors to help discuss this message with patients. And milestones is my topic of interest, if you will. Years ago, nearly 30 years ago, when I started in chiropractic, I started out with really a strong interest in hypoxic injuries, oxygen-deprived injuries. And so stroke and cerebral palsy were two big categories. And as I began that journey of taking care of those kinds of children, I learned a lot about how we develop, how not having proper neurological function, not having proper oxygenation to our nervous system can affect our growth and development. And so whether it was the adult with a stroke, a child with an infantile stroke, or cerebral palsy from a traumatic birth. So that's what started me nearly 3 decades ago. And then I did a venture within pro athletes, if you will, look at pro volleyball, pro wrangler, pro baseball, a variety of things there. And then lo and behold, I have 5 children now. I think nothing makes us more sensitive to the issue than when you have your own children.
Mm-hmm.
For the most part, I had 5 children, or I have 5 children, excuse me, and my oldest is now 15, my youngest is 8, but they were basically born within the chiropractic office. So dealing with issues between ear infections to ADD, ADHD, my children have been fortunate to not experience those, but as a consequence, it drew me closer to the population and what they're suffering. And as I did that, it drew me to more answers and more ways of helping my patients and helping basically a lot of children. And so nowadays we have strategies of what we can do, but part of this is empowering patients as to what they can see, moms and dads, earlier in their child's progression to, one, not be alarmed, not be overly concerned, but know how things should be going. For example, not too long ago, I was speaking to a mother about her young boy, and she said, well, I think he's nonverbal. And I said to her, newsflash, all boys are. Men are. What a beautiful woman, and watch him become nonverbal. And she kind of laughed. So I just let her know that men, for the most part, can go fishing with each other, not speak for the entire weekend, and tell stories for 25 years. I said men, by and large, aren't good with verbal skills, especially when it involves a female. So I put her a little bit at ease with that, and then I went into what boys and girls should be like and where we can look at our milestones. And so if you're good with that, let's break into some of those milestones. Would that be good?
Yeah, that'd be perfect. Because I know there's a ton of them there, but the ones that are like really important, I would love for you to share on.
Absolutely. And a few that I'll go through are mainly concerned with the first year of life.
Okay.
Once you get past the first year of life, for the most part, the big foundation is laid down. And so what I'd like to think about is first is simply head hold. And a baby's ability to hold their head up is probably one of the most important things we can address as parents, but also as healthcare providers. We know from an infant's issue, an infant's perspective, being able to hold their head is vitally important, but so is it for mom and dad. And we know as chiropractors, we oftentimes talk about the cervical curve. We oftentimes talk about things such as text neck or forward head posture. So some of the same issues occur in mom and dad that we look at in our children. So if we talk about head holding, we could say that at least by the time a child is 3 months of age, they should be able to hold their head well. And what that means to hold their head well, I mean to hold their head up and begin looking side to side. And so almost any parent will recognize if their kid is not looking to one side more so than another. They'll say, well, he looks to the right, but doesn't really look to the left. Now, he may have a vertebral subluxation that's impairing his movement pattern, and therefore subluxation adjustments, corrections are important. But then what we're looking at also is that maybe brain is not developing on target or on task or on time. So head hold is probably one of the most important milestones. Now, it's very, very common for a child who's gone through a healthy birth, healthy gestation, to have fairly decent head hold at birth. And so when mom and dad hold that child, they look to see and can notice if the head's floppy or not, sometimes the bobblehead, if you will. So they know. I often tell my doctors is that if a birth was traumatic, it was prolonged, if the child was premature, those are clinical factors that should raise the doctor's attention as to what degree of tone the child may have. And so when we look at head hold, when we look at these early milestones, the underlying term behind all that, it really is a term called tone. And tone refers to the resistance that a muscle has. And so in other words, our back muscles, the back of the neck, if you will, the suboccipital muscles, keep our head in one regard from going forward. So we're trying to hold our head up. And the idea is that gravity is kind of always pulling us forward. So we work to develop to hold our head up. And doing that involves the small muscles at the base of the skull and the upper vertebra, and then along the base of the back of the neck as well. So head hold could be fine by at least 1 month. If the child's not holding their head well by 3 months, they should probably see the chiropractor or a clinician, healthcare provider who works with tone. And not that the pediatrician can't, but I think chiropractors are more versed in palpating tone, the observation of tone, and more than anything else, having a correction for it. Because correction must involve removing a subluxation as well as neuroplastic strategies to build tone. So my first milestone I always like to get into is how's their head hold? And then if we go further along that same line, we have a test called pull to sit. And so most any parent can go and Google or YouTube the test called pull to sit. Now sometimes what you'll see in the search words or the keywords, if you will, is what's called head lag. And so the idea is that when a parent puts their fingers or the thumb or their finger in the child's palm, they'll grasp it, then the child will start to pull to sit. So typically imagine that the child is laying on their back and mom or dad are playing with the child grasps their fingers, then they start to kind of pull up. Well, the key behind this is that by 4 months, a child should be able to pull up into a sitting position. But the idea is that as they pull up, what we're watching for is how well they hold their head. So if there's any type of lag, if you will, then that can demonstrate that their head hold or their neck tone is not really quite as strong as it needs to be. So imagine this, if you and I were pulling each other up from a seated position, if our head was kind of falling backwards, that would be a failed pull to sit test. You would think that more doctors do this test on a regular basis. Jay, I've traveled the world, and to be honest with you, most pediatricians don't do this test. Most chiropractors don't do this test. Now, a lot of people who've been through this program do this test on a regular basis because it's an emphasis of what we do. But many, many times I'll have a patient come in at 6 months with a child who fails the pull to sit. Hey, if your child fails pull to sit by 6 months, they have a confirmed hypotonia or an aspect of developmental delay.
Okay.
The nice part about that is we're dealing with tone. So it's weak muscles that are the reason why the child can't hold their head very well. So as chiropractors, that gives us a strategy that we can implement using primitive reflexes, vestibular system. We can do strategies to strengthen those muscles and improve head hold in typically a very short time frame. But what we do know neurologically is that if we don't address the tone weakness, that weaknesses in motor development can lead to weaknesses in cognitive or behavioral development. So for the most part, children who later on develop ADHD or some of these spectrum disorders, if you will, typically had low motor tone beforehand. So I advocate to all parents to have the chiropractor, to have the pediatrician do the pull to sit test, assess for head hold or head lag within 6 months. That's got to be there because if so, we can make some early intervention steps to possibly prevent something that could be ugly later on.
Right. And I'm glad you mentioned that because a lot of parents know about tummy time and putting their kids prone and having them pull their heads up, which is testing the strength of the muscles in the back of the neck. But this sit test, I mean, it's something I'm doing in my office, but that's something that, most parents I think might be do playing wise, but then think like, oh, don't do that because the baby can't do it. And then but they don't recognize like how important that can be as a test of how the baby's, the tone of the neck muscles in the front is.
Absolutely. And parents are growing onto the idea of what tummy time is. And and the necessity of doing that. But what they sometimes lack is, what are the different versions?
Mm-hmm.
I was just talking to some doctors this past week, and I said, hey, you can put an infant, if you have hardwood floors, put an infant down on a little towel. And I said, just pull them around on their tummy.
Yeah.
It's fun, just have play, because what you want them to think about is not that they're delayed, but that they just need more time in the gym, if you will.
Right.
So create a gym in the home. And
Right.
so even in the summertime when they're in the pool, give them something kind of hang on to with their hands and pull themselves while they're naturally holding their head up. And what I get into, especially in my courses, if you will, is I break down the vestibular system. And that so much of our neurological health and well-being centers around our head being in the right position, our eyes being in line with the horizon. And that's a key point that we want our parents to understand, is that do things that put the child's visual field in line with the horizon. We all know about technology, about iPads, phones, and so forth, that we all tend to look down. What we want to realize in working with the tone of the neck and brain development and meeting milestones is we want to get ourselves where we're looking kind of up. So those things that we can do from a tummy time perspective is phenomenal for child development. And sometimes we go, okay, we put the child down, they start crying, we give them to mom. And so, but we got to help dads kind of to hang in there, because the child may cry, may be fussy because they can't hold their head very well. So I tend to teach doctors strategies to do things in 2 or 3 minute increments. So do a strategy or an application for a few minutes, then give it a break. Then let's go do something else, and then give it a break. And so
Right.
multiple integrations all throughout the day, and then obviously coming in to get checked by us to make sure they're on track. So a child who at 6 months is showing you head delay, really with the proper care, that should be corrected within 7 months. So within about a 4-week period, that should be resolved. Because changing that motor tone we can do fairly quickly if we implement these strategies.
Right.
So going along with what you're saying, head hold, pull to sit are phenomenal early milestones that parents can be aware of and start to look for. And if they have any suspicion at all or concern, ask the chiropractor. Almost every chiropractor understands the importance of the cervical curve and holding their head up.
Right.
Right?
Yes. And so many parents will notice, or they'll know that at 3 months is around about the time they're doing it. But parents seeing their babies every day are noticing the left to right, that they go just fine one side, especially in tummy time, like that, loading the muscle system that way. The babies will turn like only to one side, no matter what kind of stuff they're doing on the other side with making toys rattle and everything. The babies won't turn. So they know something's wrong or off, but they don't know where to go. And that's a great education right there.
That's going to be our message, right? And then the next milestone that I look at is really important, because I think it's grossly overlooked in people today. And that milestone is what I call rolling. So by 4 months, a baby should be able to roll front to back and back to front. I tend to say that, and especially for the parents that are listening to this, I think we're in a very one-plane dominant environment. In other words, many of us sit at a desk all day long. Even our kids sit at a desk all day long. And maybe we go run on a treadmill, maybe we go on a bike, maybe we get on a cross trainer, we get on elliptical as parents and exercise. What we're missing there is we're just in one plane going front and back, and we're not going side to side. Our kids, to develop in a healthy pattern, need to move from side to side. And almost every parent will tell you that if you put their kid on their back, they oftentimes will rub all the hair off the back of their head, trying to flip over on their stomach. So children naturally want to go and roll. So what I tell parents is that when they roll, that's a healthy stimulation of their vestibular system, their inner ear. Because it's the inner ear, the semicircular canals that are involved with turning or spinning, is what really solidifies our cervical curve and our head hold. And I said, if we as adults were to lay down and were to roll across the floor, if you will, or roll the floor across the room, we would hold our head steady so we could do that. And so the same thing's taking care of our kids. So I said, naturally, a kid should be rolling front to back and back to front by 4 months of age. So let's say that by 6 months of age, if they're not doing that very well on their own, we need to implement strategies to help that take place. First, make sure they're seen by a chiropractor or someone trained like this to assess for subluxation that might be preventing a motor development or impairment. Then we need to look at getting them to roll. I was teaching some doctors this week on how to do a very, very simple application where parents could imagine a mom and dad staying on each side of the bed. And the child's in the middle of the bed, and mom kind of lifts the comforter up on one side, and the baby kind of rolls a couple times towards dad. And then, everyone's having family time, so we're laughing, we're interacting, so the kid's getting their vagal tone development along at the same time as they're developing postural tone increases. And then dad could roll to mom, then mom could roll to dad. And I say all these strategies are only for a couple of minutes, but they're wonderful strategies to begin to increase tone, fire the canals, and fire the cervical neck musculature to develop good postural tone. And for my doctors in a way, and for the parents, I teach the doctors this at a much deeper level, but it's not really so much for parents to understand all the vestibular intricacies as much as a child needs to roll.
Right. Well, and why might do babies only roll when they're on the changing table with the poopy diaper though? That's the time when they're practicing the most, it seems like, come on, kiddo. But maybe they can think of it then as being like exercise for their brain instead of being so frustrated.
Absolutely. And what we have to do as parents, if you will, we have to kind of create that in the environment. So when we're engaging with our kids, we have to kind of know that we need to roll as well. That could be one of our playtime strategies. And getting chiropractors to share that with their families and getting parents to be aware of, that time with the child is not just rolling a ball to them, but all kinds of activities, and especially when they're in that first 2, 3, 4, 5 months of age, that's when a lot of this is really starting to kind of kick in. So parents sometimes need a little bit of encouragement as to what could be done that would still constitute tummy time, but would help us to meet those milestones as well. So I tend to say that if by 6 months your child's not rolling well, we need to bring that in as a strategy. That could be a very, very early indicator of tone not quite where it needs to be.
Okay.
So plenty of time to take care of it. So that's my third big milestone.
Okay. And rolling and that pivoting in the middle of the spine there really sets up other movement coordinations later on. That's why it's so important, right?
Exactly. And the very next milestone I'd like to kind of dive into is what I call extensor thrust. And so now what happens if we follow these progressions, we say, well, hey, by 1 month of age, a child should be able to hold their head. So by 3 months of age, if they're not holding their head well, as clinicians, we have an indication that we need to do some work on tone. Then we say by 4 months, they should be able to do a pull to sit. If they're not doing that at least by 6 months, then we got to do some tonal strategies. So still plenty of time to get them caught up, right? And then the progression from that is now they should be able to go from a pull to sit also now into a roll, front to back and back to front. If they're not doing that by 6 months, we need to start implementing those kind of strategies, the early interventions, if you will. And then what that leads us up to, because now by the time a child can roll front to back and back to front, they're really ready now to get up into a sitting position very well with stability. And now when they can sit, now what they want to start doing is they want to start kind of pushing away. And what parents need to know is that pushing away is helping develop their lower extremities, their glutes, their quads, the lower limbs, if you will, where they can kind of push because they're getting ready to start walking.
Okay.
But before
pushing away, you mean with their legs or with their feet against you? Okay.
Exactly. So like what we might do if we're getting in the blocks on the track and field.
Okay.
And so then what happens is now, because the child's getting ready to go into a crawling, and crawling is that intermediate stage before we get to standing and walking. But they've got to develop their quads and how their legs are moving from back to front and front to back as well. And so in other words, when one leg goes back, we want the other one to kind of begin to come forward. And the kid will start to rock and do a variety of things. So this extension thrust milestone should be kicking in by about 6 months. And so we sometimes say between 6 to 8 months, there should be some transition to crawling. Okay. So now the child's kind of on their way, but we want them to have good stability. And so sometimes if we as a parent put a 6-month-old on their back and put our thumb pads kind of into their heels and kind of rock them back and forth, the child would eventually start to kind of push against you. Mm-hmm. And that's what we're trying to do. Now they're starting to extend the leg, extend the knee against that. And this starts the formative process of what's going to later be called cross crawl. And that they'll begin to integrate that into their toddler crawl, if you will, which will eventually become their toddler gait. And so that's the next one I really want to get into is what's called extensor thrust. Because about this time, what a parent might notice is that their child sits, but they sit in like a tripod sign. So they sit with their legs kind of straight out in front of them. Now, many parents have used what's called the bumbo seat, or they've used foam devices to kind of prop their kid up. Well, there's pros and cons to that. But one thing what we're looking for is that we want the kid to get their legs underneath them so they can begin to push back so they can propel forward. And so if we see that the child just sits in a tripod position and doesn't really want to crawl or get on their hands and knees, then we know that they may have some quadricep weakness. Again, tone of the glutes and the quads. So we want to get the legs underneath the child and begin to get them to kind of push off. Now, sometimes the kid will kind of rock back and forth a little bit and they don't seem like they really want to go anywhere. We have to be patient and let them know this is coming, but we have to load the muscles and load the joints to get them there. And so then once they start trying to show this progress of extensor thrust, we need to give them a platform or stage. And so one thing that I use very well is stairs. And for all of us, when we start to go upstairs, we have to press down and we have to extend and push up. So I tell parents, if you have stairs, 6 months of age is a great time, sometimes a little bit younger, to put kids on stairs to start going up, because they naturally will hold their head up, they'll weight bear, and they'll start to push away. Now, obviously, they can't come down the stairs very well. So we have to be aware of that, but they'll love to climb up and up and up. This is why, as parents, we know kids want to climb everything, right? They want to climb on the back of the couch, they want to climb up on the counter, they want to climb everything. So a stairwell creates a kind of like a contained environment to help them work on. Now, it's also another example of tummy time, but in that tummy time where we're having head hold, we're also working on triceps, we're working on the legs for extensor thrust, another great activity. So I tell moms and dads, hey, if you have some stairs, let's put them on there for a couple minutes and work with them. Now, sometimes you'll see them not use their left leg. And the reason that is because brain develops in a very, very unique way. Brain develops from the right to left side. And so the first couple of years are very, very heavy to right brain development. And so right brain development is very much about the spine, as well as the shoulders and the hips. So stairs and this extensor thrust helps give them strength to their hips, as well as their shoulders in that 4-point stance, if you will. So that's the next milestone I think is really, really critical for parents to kind of watch out for. And we've got to make sure we help them or help parents understand that we don't need our kids to start walking at 6 months. We need them to have that 2 or 3 months of good crawl time. So as we go through these milestones, head hold, pull to sit, rolling front to back, back to front, and now migrating into extensor thrust, when children are meeting these milestones with regularity, they're doing just fine. So that last milestone we kind of get into is that by the end of the first year of life, we want them to kind of stand upright. So now we give them a good foundation to get there. So it's kind of like my 5th milestone, if you will, is that by the end of the first year to be upright. But we want them to do so with confidence. Now, a lot of children want to pull up ahead of time because they want to pull up on the couch, they want to pull up on the coffee table and begin kind of moving around. We've got to make sure they spend a little bit of time, a couple months at least, if you will, in that good crawling phase. So I sometimes tell parents, I say, hey, you know what? When they want to stand too soon, playfully push them back down. But what I emphasize to the parents at this time is what you want to do is create an obstacle course. And so I think about it just like if you and I had a 4-wheel drive Jeep. It's only fun if we can go off-road. So the fun thing about going off-roading is that you're not on an even terrain. And so I sometimes use this analogy. I'll say, how do we develop flat feet? And people go, I don't know, weak muscles. Says, yes, we develop flat feet by walking on flat surfaces. Because the surface that we're walking on doesn't encourage us to use muscles that would maintain the arch of our feet. So what causes children to not walk properly or not develop their milestones? We have to create an environment which allows them to move, have that side-to-side movement, get the alternating hips and the alternating arms and legs in a way that they develop a strong foundation. So I said, get some big throw pillows, put them down, and let kids kind of crawl all over them. What it does, it creates a 4-point independent suspension, much like you would have in a 4-wheel drive Jeep. And then when they can master and handle, a living room full of throw rugs and throw pillows, then they'll be able to, when they start to stand up, they'll have stability. And I said, that's what we want for our children, because then there's good motor development, which leads to a transition into left brain, which is where they start developing their cognitive skills.
So you're saying going back to the crawling, like if they're not using a left side as much, that's pretty common?
It's very common because it signifies typically a weakness in the right brain development.
Okay.
So it's a maturational delay. This is why when we see imaging of children with ADHD, if you will, the problem is really in the right prefrontal cortex. When we see kids who are dragging their left leg, the right side of the brain controls the voluntary activity of the left leg. Our posture, our spinal tone is a feature of right brain development. So without getting too heavy, but for parents, what we want to realize is that we have 2 arms and 2 legs that should be equal. But the 2 sides of our brain are very, very different and unique. And so our right brain tends to see a big picture idea, left brain tends to see all the details. But as we develop our motor movement, our tone, our crawling, our rolling, our walking, then our arms and legs feed the brain so that both hemispheres can be equally stimulated to function independently.
Got it.
Cool thing. So milestones is a wonderful topic. I hope many thousands of parents will listen to this podcast. But that's how I begin to kind of integrate a lot of parents through this first year. Head hold, pull to sit, rolling, extensor thrust, and walking upright.
Same. Very nice. Well, with all of this information here, do you have other like resources for parents that they can get either in touch with you, or I don't know if you have courses or anything like that, or information on your website they can check out more? Where should they go to?
Absolutely, Jay. Thank you so much for asking. My website is www.braindc.org. And I have a lot that I teach. I have courses for parents. I have courses for doctors. I teach a course called Functional Neurology for practicing chiropractors that ties a lot of this in. Also, as you know, I teach for the ICPA, and I teach for many state and national associations as well. So parents are welcome to call me. They can email me at Dr. Hall, DRHALL, at braindc.org, or they can go to my website, braindc.org, and I'm happy to talk to them and help them.
Great. Thank you, Mike. I'll make sure those links, and then also your is in the show notes there for you listeners, so you don't have to like pull over on the side of the road and write it down right now, but it'll be in there. And Mike, I know of your programs for us docs through the ICPA. I didn't know that you had programs for the parents as well. So that's even more value to be able to bring to us parents that need a little help and understanding like what's going on and some practical tools. What do you think is like a major takeaway you'd like the parents to get from what we talked about here today? Either something we talked about you want to reiterate and hammer home, or something we didn't get to that you'd like to share.
I would say the single biggest thing that our children need is playtime with mom and dad. And that's the key, because we talk about tummy time, we talk about tone, when it all comes down to a nutshell, we realize our children just need love and time. And that's where we need to play. If we can do that with a regular sustained basis, children will be fine.
Very good. Like tossing them on blankets in the bed and everything like that.
You got to play. Get the towel around the house and throw some pillows down and roll across the bed. All the good things we did as children.
Right. Well, Mike, thank you so much for joining us. Thank you for sharing your knowledge and wisdom. And please, parents, check out braindc.org. I'll have that again in the links. And hopefully we can have you on another time, Mike, to share even more.
I would love to. Thank you very much, Doc.
Hi, it's Dr. J again, and I want to thank you so much for listening to the podcast. It's something I really enjoy doing, and I, as a parent, learn a ton from these experts coming on and sharing their wisdom, so I hope you're getting a lot out of it too. And I want to share something else with you. I've created a guide called the 40 Ways to Connect with Your Baby During Pregnancy. It's full of simple things you can do on a day-to-day basis that will help strengthen that bond that you have with your baby. It's a free download. You can go to my website at drjwarren.com/40ways and just enter your email. I'll send it right to you. You can download it and start working on it right away. All of the research that I'm learning in the fields of epigenetics and attachment parenting is showing that the more bonded you are during your pregnancy with your baby, the better the birth is going to go and the better parenting is going to go, because you have that strong foundation, a strong connection to build upon. So go again to my website. It's drjwarren.com/40ways and get that free guide. And again, thanks for listening.